Hey, welcome to Socialism for All. Today's date is December 22nd, 2021. In this video, we're going to get caught up with some of the latest pandemic developments, particularly some of the things around Omicron, which just came out the other night that it is now 73% and growing of U.S. cases. So it became dominant in about 2 weeks. That is how contagious it is. Highly, highly contagious. We're going to go into that and how COVID is airborne and some of the economic background of the kind of shape that the U.S. is in. We are also going to watch Joe Biden's press conference from yesterday. The original video is over 20 minutes long. We're going to watch the whole thing and comment on it, so this will be kind of a long video. If you like this video, please click like and subscribe and consider supporting on Patreon, patreon.com/socialismforall. So this started for me Monday night. Basically, I was going to go to bed and I was like, oh, let me just check if, for the weekly update on the CDC COVID tracker because, they don't update it Monday morning. It takes time for all the data to come in. And then, usually Monday night, there's some kind of update. And I saw this and I could not believe it. I absolutely could not believe this. Basically, Omicron jumped from about 10% to over 70% in 1 week. And that is insane. But that's where we're at. It's about as contagious as measles. In epidemiology, there is something called an R0 number. This is how many people you're likely to infect when you have an infectious disease. And measles is about 12. And this is up in that ballpark. It's significantly more contagious than Delta, which in turn was significantly more contagious than the original COVID. Also, get vaccinated and get a booster shot. Literally pause this video if you have not done both of those things and go make an appointment to do whichever one you need. If you haven't gotten vaccinated at all, pause the video, go make an appointment to do so immediately. Try for Moderna. That would be what I would suggest is your first option. It seems to work the best. After that, maybe Pfizer. And on the booster shot, same thing. Personally, if Moderna or Pfizer weren't available, I would probably wait until they are. I mean, keep looking. Don't just keep it open-ended. But the other vaccines so far, from what we've seen, Omicron is more vaccine resistant. That's why the booster is needed. You need a booster to get just the same level of protection because this strain evades it. Also, natural immunity. If you think that natural immunity is going to cut it, it does not. One of the first recorded deaths of Omicron was in a man who had been a survivor of the earlier rounds of COVID. I think he had gotten COVID more than once, actually, including Delta. So you cannot coast on natural immunity. You can't even coast on just your initial vaccination. If you want actually thorough protection, good protection, get your initial round of vaccine and then the booster shot. Make an appointment with your doctor's office right now, or a local pharmacy, like CVS or Walgreens or whatever you have in your area. Your supermarket pharmacy may have them. Just, Google your state name and then where to get COVID booster. Usually you'll be eligible after a certain number of months, maybe 6 months after your initial vaccination. But seriously, Omicron is spreading like wildfire, and it is more vaccine evasive. So you need the booster to maintain the protection. And before anybody jumps in, there's always a few sort of weird populist contrarians. We're going to be like, oh, you're going to bat for Big Pharma. Is it going to bat for Big Pharma when you take a pain reliever because you have a headache? Or is it going to bat for Big Pharma when you take insulin because you're diabetic? No, it isn't. No, it isn't. So we can criticize all day long the for-profit system, the mode of production. But the fact is, many medicines are really good at what they're doing. And this is a preventative that we have. You can't just risk it, because even if you don't die from COVID, which there's always that chance, and do you really want to play that game of Russian roulette? There's also long COVID. You can have all kinds of negative health outcomes that are not death. Just seriously, get the vaccine, get the booster. Again, pause the video until this is done. Okay, everybody's set. Everybody's at least got their appointments scheduled. Let's proceed. All right, so we saw how overall Omicron just knocked Delta out percentage wise. I mean, Delta's still around. Omicron is just also coming in and spreading like wildfire along with it. So we've seen that overall. Let's look also at the CDC's map of different regions of the United States. And of course, orange is Delta and purple is Omicron. This is how it's spreading in different areas as of December 20th, 2021. Now, basically collected the same day, more data. You can see the overall case curve, and that's trending steadily up at, I don't know, about a 60-degree angle. That's quite alarming. Deaths, not quite there yet, although clearly trending upward. Now, let's look at a couple of more unconventional charts. This first chart is a comparison. The orange line, or orange, yellow, whatever you want to call it, is levels of COVID in sewage, wastewater. So this is one way that you can track the level of virus in the population because it gets transmitted through sewage. Now, you can see that at every stage of this graph, two things are true with two exceptions. One, the wastewater curve is closely matching the clinical cases curve, and it's a little bit ahead of it. Also, second, the wastewater curve is lower than the clinical cases curve. Now, the two exceptions are right in the beginning. The wastewater curve has a huge peak and the cases don't. Well, what would account for this? Basically, the testing wasn't up and running yet. It was the start of the pandemic, and that system wasn't running yet. You can see, however, that, and this is directed at all the people who say that masks and distancing and shutdowns don't work, there's a gigantic drop-off. Why? Because masks and distancing and shutdowns work. And then, in fact, every time that they relax those restrictions, there's a gigantic spike within a month or two. So just note that as well. Now, the other exception is the last month or so. Why is that? Well, I mean, we're going into the winter. Everybody's breathing recycled, dirty air that has COVID aerosol particles in it. I mean, this is the same thing that happened last winter. There's no reason why you wouldn't expect this to happen again. But, I mean, that's at least why the wastewater thing is going off the charts, plus we're in Omicron town now. But the clinical case curve hasn't caught up with it yet. I don't know exactly what's going on here. Clearly, there's not enough testing. But, I mean, the wastewater line is now above, if you trace it back to the middle of the graph, that's above the peak from last winter of the clinical cases. Look at where the wastewater curve was at that point. So is this just dramatically underrepresenting how many cases are going on out there? I think so. In fact, let's look at something else. This is more of an unusual chart, but hey, epidemiology is where you find it. So look at this graph. Kind of looks like the COVID curve, doesn't it? You got a big spike last winter and then another big spike happening now. What is it? It is Amazon reviews for Yankee Candle candles complaining about no smell in the candle. Well, now, does Yankee Candle, which, I mean, it's famous for if you ever walked by one of those stores, you can basically pass out just from passing within 20 feet of the store entrance in a mall. They're so fragrant. People getting them and, I can't smell anything. Gee, it must be something wrong with the candle and not, I got COVID. And one of the main symptoms is that you'll lose your sense of smell. Well, it kind of looks like that wastewater chart, doesn't it? Kind of does. And what are we seeing? It's going up at about an 80-degree angle. Yeah, that's pretty much what we would expect. So it seems like a lot of people may be getting COVID right now and aren't getting tested. It's not showing up in the test results. Also, though, we know that a lot of states just aren't reporting their COVID data. So that's another issue. But to me, looking at this is like a nightmare scenario. Heading into the third year of the pandemic with a fresh wave of a much more contagious and really not necessarily milder at all strain. I don't think that the U.S. is going to be able to take it. Here we see a story from December 18th This is by Brian Amaral at the Globe. The Rhode Island healthcare system. For people outside the U.S., Rhode Island is a very small state on the coast, basically between New York City and Boston. So, Rhode Island healthcare system, quote, is currently collapsing. Emergency doctors warn, quote, no one who is practicing medicine alive in this country right now has ever experienced what we're going through right now. The president of the Rhode Island chapter of the American College of Emergency Physicians told the Globe. And basically in this story, they talk about how these systems, emergency care units, are missing like 25-50% of their nurses and other staff. We know that there were mass resignations, people getting burned out in 2020 and into this year because just there wasn't PPE, people couldn't get masks. You know, healthcare workers were having to wear garbage bags into work because the equipment just wasn't being made and given to them. So again, entering the third year, the U.S. is already greatly weakened. COVID-19 deaths under Biden surpassed the deaths from the Trump administration. That was this year. Meanwhile, what is Biden doing? I saw a bunch of tweets about their new dog. Like, it's baffling. I mean, it's astounding. Also, what's the state of the economy right now? Well, here's one. This is about the child tax credits and what people who received them spent them on. Bear with me here because I think this is very telling in terms of the kind of situation that the U.S. is in. So the Democrats were really proud of this child tax credit that they gave that was going to eliminate all kinds of child poverty. Well, Bloomberg has a story here. What did people spend them on? Number one, 59% of people spent them on food. Food was the most commonly purchased thing with the child tax credits. Next, number two, utilities, 52%, keeping the lights on. Third, rent or mortgage, basic housing, 45%. Four, clothing, 44%. You are literally talking about basic needs. Food, electricity, hot water, housing, and clothing. Those were the top four items that basically at least 50% or close to it, 45% of people were spending their child tax credits on. People are struggling to provide the bare essentials for themselves right now. And so when you give them money, they buy food with it. That's where we're at. Meanwhile, look at how Bloomberg puts it down below. It says, here's what families are actually using the child tax credit to pay for, but then a very infuriatingly misleading synopsis. Parents and caregivers have put the money toward debt and household expenses, Census Bureau surveys have found. It's not technically inaccurate, but it's highly misleading because where is paying down debt in the chart? Oh, it ranks number 7, just 17%. That's about 1 in 6. Completely overlooking that people are struggling to pay for food, utilities, rent, mortgage, clothing. Clothing. People are trying to buy warm jackets and stuff for the winter. That's what's happening right now. Paying down debt was 1 in 6. And then, savings and investments was 1 in 11. Staying with the economy for a minute, here is another infographic. This is from Data for Progress. The title is, How Confident or Not Confident Are You in Your Ability to Make Student Loan Payments when the current pause on repayments ends February 1st, 2022. Now we're going to read the data. I think breaking as I'm recording this is that Biden is deciding to extend the pause until May. So that's good news. It has yet to be, I think, confirmed, but it looks like that's going to happen. But let's look at where people are at. And, they basically left people hanging here with about a month to go. So of people who have student debt overall, just 13% said that they were very confident that they could make their student loan payments beginning in February. Another 19% were somewhat confident. And then another 19% were a little confident. 49%, so basically half, said not at all confident. That's where we're at. Why? Because the economy is a gigantic disaster. Like this whole, quote, labor shortage. Meanwhile, there's record profits. What's going on? They really just don't want to pay people. Plus, now with the Omicron, who the hell wants to go to work? you're going to be out there sacrificing your life for $11 an hour in an environment where COVID is airborne. They're not giving you masks. They're not making customers wear masks. We're going to talk more about that in a minute. Looking back at the student debt infographic, they also break it down by parent status, whether or not the debt holder is a parent of a child under age 18 or not, and also whether they received the child tax credit or not. We see that there are pretty negligible differences between the parent status or not, but there's a pretty significant difference between the group who received the child tax credit, because they were much less likely to say that they were not at all confident about making student. I mean, there was still 41% who weren't at all confident that they could make it. But this is in contrast to 54% of those who didn't receive the child tax credit. So you got a 13-point difference there between people who received the child tax credit or didn't, in terms of their confidence in being able to resume making student loan payments in February. So I should mention also here that in addition to Data for Progress, this infographic is brought by a coalition to increase the child tax credit. All right, now let's talk about COVID itself, and specifically the fact that COVID is airborne as we start to transition into the Biden press conference. Because this fact that COVID is airborne and that you need masks has been just systematically ignored by the Biden administration for a very long time now. In fact, my first video on this, where I really started doing this type of video in earnest, was in May, mid-May, when Biden basically declared like mission accomplished and told everybody to take their masks off. It was unfathomable to me at the time that they were doing this, because there was absolutely no indication that this was a good idea. Again, vaccines, get them, get your booster shot now, but they primarily just work to reduce symptoms. They don't really work so much on transmission. Why is that? Well, because it's true that vaccinated people, your immune system has already been trained how to fight COVID. So if you catch a wild COVID infection, not a wild like a bad one, but like you're out in the world and you just catch COVID. Okay, well, if you've gotten the vaccine, your body has already been trained on how to recognize the virus better at the molecular level. Great. So your body starts to respond to it more quickly, and your viral load will drop more rapidly. But it doesn't drop for the first few days, which is also the time you're least likely to have any symptoms. So you're most likely to spread it. Your viral load will be at its peak, and then it'll drop off after that. But what we've seen is that vaccinated and unvaccinated people have comparable viral loads in those first few days. So really, vaccinated people can spread it pretty much just as much as unvaccinated people, except after the first 5 or 6 days, it starts to drop a lot more in vaccinated people. But by then, you'll probably already know that you got infected, and you'll be taking more measures to isolate yourself and, to basically reduce exposing other people to what you've got. You'll take efforts to reduce the spread by that point. But, in those first few days where a lot of transmission happens, it's pretty comparable. So we know that the vaccines have more of a minimal effect on transmission. What really helps transmission? Masks, and more masks, and distancing, and shutdowns. That's what helps with transmission. Biden has not been real big on that. In fact, ran on a mask mandate and then didn't do it. Instead, they're pushing the more controversial vaccine mandate. Now, again, get vaccinated. Very likely that the vaccine is going to greatly reduce your odds of the more severe health outcomes, and you're not going to clog the hospitals then, and you're not going to wind up disabled or dead. Okay, great. We want that. But Biden is absolutely dropping the bag on containing the transmission. So, in fact, here's a statement from whitehouse.gov. We are intent on not letting Omicron disrupt work and school for the vaccinated. What? You've done the right thing, and we will get through this. For the unvaccinated, you're looking at a winter of severe illness and death for yourselves, your families, and the hospitals you may soon overwhelm. I can't believe they wrote this. I can't believe it. But again, I think that this is more of what the, press conference is going to be like. Okay, but we should let Omicron disrupt work in school. This is like, I'm like dumbfounded. I don't know what to say. It's a serious danger. Breakthrough cases are a real thing. Like I've said 20 times, get vaccinated. But the vaccines aren't bulletproof. They will greatly increase your odds of surviving, having a mild or even asymptomatic case if you get infected. But you can get a breakthrough infection. It happens. It happens all the time. It's a danger. We have to control transmission. And they're basically putting this all on the unvaccinated. That's obscene. Let alone that Omicron is more vaccine resistant. So you can do all the right things. You can get your, 2 initial shots, and you can even get the booster. And you still don't have perfect odds. This is insanity. Also, you run a strategy like that, you're upping your odds of mutations. Omicron wasn't here, and then it was. Now it's here. And it's too late. You can't put the toothpaste back in the tube. All right, so let's have the conversation about COVID being airborne and what does this mean. First, infographics, then I got 2 videos for you. So what does it mean if you don't recognize the aerosol transmission? Basically, they put way too much emphasis on large droplets. Now, surgical masks are kind of a directional mask. They have more of a gap on the sides of your face, but they're great for catching stuff that flies straight out of your mouth and nose. Spit, other smaller droplets, yeah, they're pretty good at catching those. The problem is COVID becomes aerosolized particles, which permeate the air. They pervade, they linger, they just hang out in the air. And if you're not running filters and things, actually, here's a good example. This was a Twitter post basically contrasting the public health messaging that is being put out there, like wash your hands, stuff like that, with what we should be getting. This graphic, 5 ways to fight an airborne virus. Wear high quality masks like an N95 when indoors. So N95s are great. Why? Because they are great filters. They filter a lot of particulate matter. And they're also snugly fitting around your nose and mouth, unlike the surgical mask. So just breathing the air, it's all going through the mask. It's unlike a surgical mask where some air can get around the sides. That's very important. Also, open windows where possible. Fresh air is good. Unfortunately, we're now heading into winter, where that's not as possible because a lot of places are too cold to do that. Next, use a CO2 monitor to assess ventilation. The goal is less than 700 parts per million. Then use HEPA, high-efficiency air filters if CO2 levels are high. And also avoid eating lunch indoors, move outdoors. Again, it's winter. That's not going to be as possible. This is part of why the winter specifically, COVID went into such a big spike last year. Also, just even not with COVID, more people die. Elderly people and fragile people in a fragile state of health tend to die in the winter, December and January, than any other months. So this is a really dangerous time. That's why we need better messaging. So again, let's look at those 2 COVID is airborne videos, and then we'll come back.
Aerosol dispersion simulations at various considered many situations. Some of them includes public transportations, like the infection risks in the trains, in the airplanes and taxis, variations like a hospital room, the classrooms, and also music halls and so on. So speaking, about 10,000 droplets emitted per minute. It is interesting to note. On the other hand, when you think, in the case, about 25,000 droplets emitted per minute, that is equivalent to the situations when you cough twice. So it means the important thing is we always consider the 2 countermeasures for that. One is a face mask to block the larger droplet. And the second one is ventilation in the room, which is important to reduce the behavior like singing or like speaking. And the second one is a distance among each person. The third one is the time we are talking or we are discussing among each person. And the last one is ventilation in the room. Always we have to consider these four factors, and we have to take several countermeasures for that. There is no perfect countermeasure to reduce the infection risk by the only one method of dispersion, but also we would like to evaluate the risk of infection directly by considering the interactions between the droplets and the human bodies.
Okay, I'm not exactly sure the name of the speaker in that video. You can see some of the credits there. I got that video from Eric Feigl-Ding, Feigl-Ding. He's an epidemiologist, runs a great Twitter account. Go follow him if you aren't already. Here's the second video. This is an expert in aerosol particles being interviewed earlier this month about the need for masks.
Unfortunately, we are not quite doing the right things that we should do, and I would say especially in the US, because it has become a political issue. There are other countries, I'm originally from Spain, and their vaccines and masks are not a political issue like they have become in the US, and that is very unfortunate. So we need to keep the mask mandates in locations and times when cases are high, but actually we need to improve the mask mandates. We need to stop wearing cloth masks and go to N95s for all. We know now that this is an airborne virus, that we inhale it, and we need to protect people from inhalation. And this message is not being communicated clearly by either the CDC or the WHO, unfortunately.
Okay, so that was Dr. Jose Luis Jimenez from the University of Colorado. I agree personally from everything that I've seen about this information, and if you're going to wear a mask, why not wear a good one? You can order N95 or KN95. These are premium masks. The KN95 is the Chinese equivalent of the US N95. You can order these in bulk for not very much money. I think I get my N95s for like $1 or something like that in a large pack. You can order them from medical supply companies that sell directly to the public. Just type in where to buy N95 masks or where to buy KN95 masks, and you should get some results. In a pinch, you can go to a Lowe's or a Home Depot, someplace like that. They usually do sell packs of N95 masks, although they're usually not the best deal. To save money, hunt around online. Like I said, there are medical supply companies that sell the real deal where you can get some actually cheap bulk packs of the good stuff. All right, so all that said, I think it's time to finally get into the Biden video, coming off of the subject of, what various political bodies are recommending. I don't think that this is going to be the most fun or positive experience of the day, but let's get into this and see what the plan is for the United States per the White House.
Good afternoon. I promised when I got elected I'd always give it to you straight from the shoulder. The good, the bad, the truth. So as we head into Christmas weekend, I want to answer your questions about the rising number of COVID-19 cases. And I want to start by acknowledging how tired, worried, and frustrated I know you are. I know how you're feeling. For many of you, this will be the first or even the second Christmas where you look across the table, be an empty kitchen chair there. Tens of millions have gotten sick. We've all experienced upheaval in our lives. But while COVID has been a tough adversary, we've shown that we're tougher. Tougher because we have the power of science and vaccines that prevent illness and save lives. And tougher because of our resolve. So that, let me answer some questions that lay out the steps the Vice President and I are taking to prepare for the rising number of cases experts tell us we can expect in the weeks ahead. First, how concerned should you be about Omicron, which is now the dominant variant in this country, and it happened so quickly? The answer is straightforward. If you're not fully vaccinated, you have good reason to be concerned. You're at a high risk of getting sick. And if you get sick, you're likely to spread it to others, including friends and family. And the unvaccinated have a significantly higher risk of ending up in a hospital or even dying. Almost everyone who has died from COVID-19 in the past many months has been unvaccinated. Unvaccinated. But if you're among the majority of Americans who are fully vaccinated, and especially if you've gotten the booster shot, that third shot, you have much less reason to worry. You have a high degree of protection against severe illness. But because Omicron spreads so easily, we'll see some fully vaccinated people get COVID, potentially in large numbers. There will be positive cases in every office, even here in the White House among the vaccinated.
Okay, so I'm going to pause it here. None of what he has said, in my opinion, is untrue. Kind of up to now, I think that last statement was misleading. So just to recap, Biden frames it with, here comes the truth. Okay, there's a rising number of cases. He's acknowledging people's frustrations. I think it goes beyond frustrations. The country is at meltdown, so you could call that misleading as well. We've shown that we're tougher. This is just empty political rhetoric. No, vaccines prevent illness and save lives. This is true. He has been dancing around the issue of transmission, though. There basically is no strategy for reducing transmission at this point. They have a one-note, vax-only strategy, and that's it. And it really doesn't address transmission. So how concerned should you be about Omicron, he says? Well, if you're unvaccinated, very concerned. Okay, that's true. Honestly, yes. If you're not vaccinated, you should be very concerned about Omicron, just like you should have been very concerned about Delta and original COVID. I mean, honestly, it's a dangerous virus that can have all kinds of weird... I was just reading something about long COVID and ties to developing diabetes in children. There's weird stuff going on with this virus that is not fully understood yet. We haven't had time to study it long term. Okay, so that's all true. Yes, vaccines do prevent illness and save lives. Again, they don't always 100% of the time prevent illness, but as Biden just acknowledged, there can be breakthrough cases. But they do generally improve your odds tremendously. So that's true. But now we're getting into, because Omicron spreads so easily, even vaccinated people will get it. Now, this is getting into murky waters because he's kind of conflating, he's trying to discuss transmission without really discussing how transmission works. Kind of just wrapping it up in Omicron spreads so easily that, probably everybody's going to get it. Okay, you can say I'm putting words in his mouth. He didn't say everybody. But he said in every office, even at the White House, etc. Well, that's not unavoidable. And the fact that there is basically no anti-transmission strategy in place, that is the core of the fucking problem right now. That is severely concerning. It should be a point of outrage for everyone in the country, at least everyone who's concerned about trying not to catch this potentially debilitating or lethal virus.
From Omicron. But these cases are highly unlikely to lead to serious illness. Vaccinated people who get COVID may get ill, but they're protected from severe illness and death. That's why you should still remain vigilant. According to our doctors, even if you're fully vaccinated, you should wear a mask when indoors and in public settings. Wearing a mask provides extra protection for you and those around you. And I know some Americans are wondering if you can safely celebrate the holidays with your family and friends. The answer is yes, you can. If you and those you celebrate with are vaccinated, particularly if you've gotten your booster shot. If you are vaccinated and follow the precautions that we all know well, you should feel comfortable celebrating Christmas and the holidays as you planned it.
Okay, that was a terrible piece of advice right there. Basically just, don't worry about catching COVID. So clearly this administration is not concerned with people catching COVID at all. So anyway, we're going to come back to that last part in a second. That basic point of they don't care if you catch it. Wow, is that an insane strategy? But how about the first part? That our scientists say that you should wear a mask. Really? Because, like I said before, the first video I did was about all the mask restrictions coming down this spring. And the White House kind of cheering that on. So what changed? Now you're saying masks, but you're saying it quietly enough that nobody can hear you? This is like printing the retraction on page 27B, like where no one's going to see it? So which is it, masks or no masks? Why are you not wearing a mask? You're indoors. It's just awful. This is such a gigantic mess. It makes no sense, and it's why we are where we are currently. So let me just play that clip back again because I can't believe he said that. And then, of course, the second part, can you celebrate safely? Yes, though you may get COVID. What? No. You just said yourself that there are breakthrough cases, but you're protected against severe illness. That's not a fucking guarantee. That is not a guarantee. And I showed the graphic earlier. The vaccines are less effective against Omicron. They're still somewhat effective, which is great, but now is not the time to literally go celebrate. I'm going to say it right now. If you have holiday plans this weekend, cancel them. If you're thinking of going somewhere, don't go anywhere. This is, oh man. Twitter has been blowing up since Biden's speech yesterday, rightfully so. This is nuts.
From Omicron. But these cases are highly unlikely to lead to serious illness. Vaccinated people who get COVID may get ill, but they're protected from severe illness and death. That's why you should still remain vigilant. According to our doctors, even if you're fully vaccinated, you should wear a mask when indoors and in public settings. Wearing a mask provides extra protection for you and those around you. And I know some Americans are wondering if you can safely celebrate the holidays with your family and friends. The answer is yes, you can. If you and those you celebrate with are vaccinated, particularly if you've gotten your booster shot. If you are vaccinated and follow the precautions that we all know well, you should feel comfortable celebrating Christmas and the holidays as you planned it.
All right, so I did just play that clip again in case you're feeling like you're having deja vu. But yeah, mixed messages there. Yes, wear a mask indoors, but don't worry about anything and celebrate Christmas. I want to hone in on something else again, though, specifically. He said that if you're vaccinated, you're protected from severe illness and death. That's not really an accurate statement. Your odds are reduced of serious illness and death, although less so with Omicron than with previous strains. So I wonder, people who take this to heart and then go and get seriously ill with a breakthrough case or have loved ones who die from a breakthrough case, how fondly they're going to look back on this little Christmas message from Biden, which maybe will have contributed to their making a decision which put them in a situation where they did get seriously ill, and so on. Continuing the video.
You've done the right thing. You can enjoy the holiday season. And thanks to the progress on vaccinations this fall, we've gone from nearly 90 million adults in July who had not even started their vaccination process to fewer than 40 million today. Still too many, but down from 90 to 40. All these people who have not been vaccinated, you have an obligation to yourselves, to your families, and quite frankly, I know I'll get criticized for this, to your country. Get vaccinated now. It's free. It's convenient. I promise you, it saves lives. And I honest to God believe it's your patriotic duty. Another question folks are asking is, what can you do to make yourself and your family feel safer and be safer? The answer is simple. Get your booster shot. Wear a mask. Our doctors have made it clear. Booster shots provide the strongest of protections. Unfortunately, we still have tens of millions of people who are eligible for the booster shot but have not yet gotten it. They've gotten the first 2 shots, but they've not gotten the booster. Folks, the booster shots are free and widely available. Over 60 million Americans, including 62% of eligible seniors, our most vulnerable group, have gotten their booster shots. I got my booster shot as soon as they were available. And just the other day, former President Trump announced he had gotten his booster shot. It may be one of the few things he and I agree on. People with booster shots are highly protected. Join them. Join us. It's been 6 months or more since my second shot. If it's been 6 months or more from your second shot when I got my booster, you can get yours today if you've been 6 months or more since your second shot. Another question that folks are asking is, are we going back to March 2020? Not this last March 2021, but March 2020 when the pandemic first hit. That's what I keep getting asked. The answer is absolutely no. No. Here are three big differences between then and now. Number one, the first one, more than 200 million Americans have been fully vaccinated. In March of 2020, no one was fully vaccinated. What that means is today, a case of COVID-19 for fully vaccinated and boosted person will most likely mean no symptoms or mild ones similar to the common respiratory viruses.
Okay, I'm going to pause it here for a minute. This has been very low information, this whole presentation that Biden is doing here. And it's been vaccine, 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 mask. And we really need a better strategy than this. Yes, vaccine, but also mask, because he hasn't said anything. I feel like a broken record here, but I'm responding to his, one note strategy. What about the transmission? What about wearing masks? Now, he just said twice, oh, and wear a mask. Yeah, but you're not actually saying that. And why do we not have mask mandates in place? And what's going on with that? So now he's trying to assuage people's fears that we're going back to March 2020, which, let me say right now, I think is entirely possible and then some. Because what he is not acknowledging here is that Omicron is more vaccine resistant. So that last statement that he just made about, if you get vaccinated with a booster, most of the cases are going to be asymptomatic or very mild symptoms. Well, Omicron has just been dominant for 1 week, and it's really just been around in the US for like 2 weeks. And we don't really know what's going to happen, really. It could be that half the country gets a booster shot, and then still, 15% of people are getting severely sick. That's not a back to normal scenario. That's going to be a political outrage scenario. So color me unconvinced so far that this, gambling on basically a vaccine only strategy is really going to deliver the results that he's talking about. Continuing.
Over 200 million Americans should have the peace of mind that they did not have in March of 2020. They're protected from hospitalization and they're protected from death. Second point, we're prepared today for what's coming. In March of 2020, we were not ready. Today, we stockpiled enough gowns, masks, and ventilators to deal with the surge of hospitalizations among the unvaccinated. Today, we're ready. And as I'll explain in a few minutes, we're going to be reinforcing our hospitals, helping them. Number three.
Okay, I really can't wait here until the press start asking some questions, because what he just said there about, they're stockpiling the PPE. If you know anyone who works in healthcare, particularly in an emergency environment or a hospital where they're treating people with COVID, ask them how it's going. We already looked at one article from the Rhode Island medical system here in this video. Things are not good. All you really have to do is go on Twitter and go follow some nurses and emergency care doctors and see what they're reporting about what's been going on the past couple of weeks. Again, color me unconvinced. I think that there are many indications that we're headed for a really serious situation in 3, 4, 5, 6 months from now.
We know a lot more today than we did back in March of 2020. For example, last year, we thought the only way to keep your children safe was to close our schools. Today, we know more and we have more resources to keep those schools open.
Yeah, so here we start going into really bad territory. That kind of is like the basic way to keep kids safe. And at a very minimum, you need to greatly reduce the class sizes and get air filters in the schools that they probably don't have a lot of the buildings. So now we're starting to really careen into very alarming territory in terms of the political messages that this administration is sending.
You can get 5 to 11-year-olds vaccinated, a tool we didn't have until last month. Today, we don't have to shut down schools because of a case of COVID-19. Now, if a student tests positive, other students can take the test and stay in the classroom if they're not infected, rather than closing the whole school or having to quarantine. We can keep our K through 12 schools open. That's exactly what we should be doing. So, folks, let me summarize. We should all be concerned about Omicron, but not panicked. If you're fully vaccinated, and especially if you got your booster shot, you are highly protected. And if you're unvaccinated, you're at a higher risk of getting severely ill from COVID-19, getting hospitalized, and even dying. So the best thing to do is get fully vaccinated and get your booster shot. And no, this is not March of 2020. 200 million people are fully vaccinated. We're prepared. We know more. We just have to stay focused.
Okay, counterpoint. Let me make the case for how I'm feeling, which is, if not panic, let's say severe alarm. All right? Though I must say, I haven't been this concerned since the start of the pandemic. Basically, if there were macro, structural, society-wide protective factors like mask mandates, like social distancing in businesses, things like that going on, more shutdowns, things like that. If that were happening, then I could say, okay, I got my booster and I'm 65, whatever percent protected against Omicron. I wouldn't be panicked. I'd be concerned about, I would only go out really for essential trips. And, I would stick to that. I mean, I'd be back to like 2020 spring, basically. But I wouldn't be panicked because I would at least feel like I'm not just, one molecule of water out in the ocean, trying to go my own way with the entire current of everything going wherever it feels like going. But when Biden just says, get your shot and then otherwise carry on as normal, that actually makes me pretty close to panic, because I don't feel like, having the kind of protection that the boosters seem to give against Omicron, which is, again, much better than not having any, but not perfect, in fact, far from it. That's not enough for me to feel secure in the slightest. So Biden here is really just bullshitting, in my opinion. And when they come out and make these kinds of assurances, which are not really well grounded, I mean, he didn't give any scientific data in this presentation whatsoever. You're basically just trusting him. He doesn't give any resources for further reading on this. Go to this, otherwise I'd be covering it. It's pretty much just trust me. And no, I'm not going to trust you, Biden. No. I mean, this is from a party that ran on all kinds of promises, really has yet to fulfill the vast majority of them. Yeah, let's continue.
So that's where we stand. Now, let me tell you about the additional steps I'm ordering today to take on what is coming. I know you've heard a lot of this in the news already this morning. 3 weeks ago, I laid out a COVID-19 action plan for this winter that prepared us for this moment. Today, we're making the plan even stronger. First, we're setting up our vaccination and booster efforts. We're stepping it up significantly. In the past 2 weeks, we've seen the highest vaccination rates since last spring. And we aren't as vaccinated as a country as we should be, though. That's why we have added 10,000 new vaccination sites on top of the 80,000 sites that we already had in place. And even more will open in January. I know there's some parts of this country where people are very eager to get their booster, where it's harder to get an appointment, So starting this week, I'll be deploying hundreds more vaccinators and more sites to help get the booster shots in people's arms. I've ordered FEMA, the Federal Emergency Management Agency, to stand up new pop-up vaccination clinics all across the country where you can get that booster shot. We've opened, we've opened FEMA vaccination sites in Washington State and New Mexico.
Can I just add on the subject of reassurances? This may be like an easy cheap shot, but it does not add to your optics when the person telling you to, like, don't worry, everyone's going to get, is himself sniffling, coughing, and clearing his throat throughout the entire presentation. Yeah.
Recently, as cases have increased. And today, I'm directing FEMA to stand up new sites in areas where there is a high demand. These steps are going to help us add more and more booster appointments and just over the next few weeks. I also want to say a word to parents. If your children are not vaccinated, please get them vaccinated. If you're a parent, understandably, who waited to see how the first shots went with other kids before getting your own kid vaccinated, you can stop waiting. 6 million children in our country, ages 5 to 11, are vaccinated. Get your children protected today, now. And for those parents out there who have a child that's too young to be vaccinated, that is under the age of 5, I know this can still be a scary time. But one thing you can and must do while we await vaccines for children under 5, get yourself fully vaccinated and boosted, as well as those around you, your children, your caregivers, your siblings. It's critical to mask up in public indoor places.
Okay, I gotta say, I spaced out for a minute. You know, the creepy whispering vaccine guy, that's all I'm really getting out of this. Stepping back, would maybe a more dynamic speaker have been a better choice here? He's just sort of trying to hypnotize people, like, get them now, get them now. And you're just like, yeah, can you stop? It's creepy. Anyway, he said again, mask up indoors. Can you put something behind that, please? We did this in 2020. It was good. We did it in 2021. It was good. It worked. It helped to keep cases lower. Can we please bring that back? Anyway, I'm just like, there's like 20 minutes left in this video. We heard you, dude. Vaccines. Got it. Also, where is the rest of this presentation?
We know that our youngest children have only rarely been impacted by serious COVID-19 cases. But they can be further protected if they're surrounded by vaccinated people. And again, to folks who are not vaccinated, you might think you're putting only yourself at risk, but it's your choice. Your choice is not just a choice about you. It affects other people. You're putting other people at risk. Your loved ones, your friends, neighbors, strangers you run into. And your choice can be the difference between life or death.
So again, he is way overplaying that, in my opinion. So this is basically, I think, how they're transferring the responsibility of this system to protect people onto individuals, which everyone could be vaccinated, there would still be a big problem. And yes, everyone should be vaccinated, but there would still be a problem, meaning the point of this criticism is that the government, the federal and the state governments, are not doing everything that they need to be doing. They're not doing the right messaging. They're not doing the right mandates. They're not doing the shutdowns as needed. This is what needs to happen. Everyone could be vaccinated and there would still be a gap. And he's not addressing that.
The longer the virus is around, the more likely variants form that may be deadlier than the ones that have come before. Let me say again and again and again and again, please get vaccinated.
Okay, we've discussed this before. I believe here that he is misrepresenting this information because while it is true that unvaccinated people have higher viral loads for a longer overall period of time, which can contribute to more mutations. Basically, the more unvaccinated people there are, the higher the odds of mutation. But even in fully vaccinated people, there is not zero risk of mutation, especially we know that vaccinated people with the kinds of vaccines we have currently still get COVID. Just our bodies fight it off more quickly, but you can still get mutations. It is less likely than in unvaccinated people. But Biden, again, is playing fast and loose with the facts. He's misrepresenting things. I find this misleading. And again, I think that the calculus here is all about putting the system failures onto individuals, which I'm not really sympathetic to people who aren't vaccinated, okay? I don't think that there's a good reason not to get vaccinated unless your doctor specifically told you not to. But it is dishonest to blame them for things that scientifically is not their fault. You can blame them for clogging up the hospital system needlessly, okay? That's something that definitely is going on. So a lot of people who wouldn't have gotten sick wouldn't have needed the hospital had they gotten vaccinated. That falls squarely on people who didn't get vaccinated. And I know that there are some complications there. Some people have like issues with access, which honestly though, it's getting easier and easier. I mean, anybody who walks into a drugstore, many of them, the larger chains, you know, they have vaccination sites there. It's getting easier and easier. So that excuse is getting a little bit more and more difficult. There are definitely things that vaccinated people are, you know, sort of failing the rest of us in society by doing. However, blaming them entirely for all mutations, etc., this is a global phenomenon. I mean, there's a lot of other things going on here. You know, but this is really just a one-note presentation. I really hope that the questions kick in soon because this is just repetitive and obnoxious.
It's the only responsible thing to do. Those who are not vaccinated are causing hospitals to become overrun again. I just spoke to the governor of New York. Every COVID-19 hospital means someone with a heart attack, cancer, or other serious illness may not get that bed and that life-saving care they need in the hospital. Look, let me give it to you straight again. Omicron is serious, potentially deadly business for unvaccinated people.
And for vaccinated people, just your odds of surviving are better. That is misleading. I really hope somebody in the press calls him on this because whoever is actually listening to this, I mean, I'm only watching it for the sake of the show and, you know, keeping really current sort of with the inside track, as it were. But anybody who listens to this and believes that they're really just, you know, they can go about their lives carefree, I think a decent chunk of them, maybe not the majority, probably not the majority, I hope not the majority, but a decent chunk of them are going to have breakthrough case problems. And this is really not the best messaging, to say the least.
Let me be clear. Thanks to the prior administration and our scientific community, America is one of the first countries to get the vaccine. And thanks to my administration and the hard work of Americans, we led a rollout that made America among the world leaders in getting shots in arms. But uptake slowed this summer as vaccine resistance among some hardened. Look, the unvaccinated are responsible for their own choices. But those choices have been fueled by dangerous misinformation on cable TV and social media. You know, these companies and personalities are making money by peddling lies and allowing misinformation that can kill their own customers and their own supporters. It's wrong. It's immoral. I call on the purveyors of these lies and misinformation to stop it. Stop it now.
Well, that ought to do it.
One of the other things that we know that has to be done is more testing. Because Omicron spreads easily, especially among the unvaccinated, it's critically important that we know who's infected.
No, not especially in the unvaccinated. Anybody, vaccinated or vaccinated, can catch COVID. You can also spread it because unvaccinated people's bodies do not fight it off as quickly. They have higher viral loads for longer. So they can spread it, transmit it, that is, a little bit more easily. But if we're talking about catching it, it's really horrendous. This is a bad presentation by Biden.
That means we need more testing. And on that score, we're now where we should be. Yes, we have over 20,000 free testing sites. Yes, we've used the Defense Production Act and spent $3 billion to to greatly expand the number of at-home tests available for purchase online and at your local pharmacy. And yes, we made sure insurance covers the PCR tests you get in the hospital or at your doctor's office.
Whoa, let's just talk for a minute about that. So in the last video, we covered how there are basically two types of at-home tests. You can buy one that's like a pregnancy test. You swab it and then it turns color in like 15 minutes. That's about $15 to $25. There's another type where you swab at home and then you send it to a lab and then they process the results in a lab. That's like $125. Currently, you pay out of pocket for those. As Biden said, if you go to a doctor's office and get the PCR test, yeah, that will be free. But the at-home tests, no. And Biden does not have plans to start compensating people for those until January 15th. Whereas, again, in the UK, you can, just for one example, you can go into a store, request 7 at-home kits per day for free. 7 per day for free. The U.S. isn't doing this. And Biden's press secretary basically laughed in the face of a reporter who was like, why aren't you doing this? She's like, what are we going to do? Send every American a test? How much is that going to cost? And then what? Well, and then you find out who has COVID. That's what happens. And then our numbers might actually match reality a little bit more closely. So Biden's now talking about testing. I don't believe he's serious at all. One of the few portions of this conference that I did see previously is where he announces that they're going to send out a certain number of tests. I believe that that's coming up. And this will confirm that they are not serious because the number is paltry.
But starting next month, private insurance will also cover at-home testing. So you can order a test online and get reimbursed. We're providing access to free at-home tests for those who may have insurance as well, may not have insurance, I should say, as well. But it's not enough. We have to do more. We have to do better. And we will. Starting this week, the federal government will set up emergency testing sites in areas that need additional testing capacity. Before Christmas, the first several of these federal testing sites will be up and running in New York City, with many more to come. This free testing is going to help reduce the waiting lines, the time you have to stand there, and sometimes it's an hour or more. We're going to continue to add federal testing sites where needed, so that if you want an immediate test, there'll be a place where you can go get it. We also need to do better with at-home testing. So I'm announcing today the federal government will purchase $500 million, that's not million, billion with a B, additional at-home rapid tests with delivery starting in January.
Wow, $500 million. Kind of sounds like a lot, right? No, not when you consider that there are about 330 million people in the United States. So 500 million compared to 330 million. Well, some of those are people who don't want tests or, I don't know. We'll just say people who don't want tests. So let's exclude randomly 80 million people from that. So we get the U.S. population of people interested in tests is 250 million people. So that's 2 tests per person. Again, UK, you can get 7 per day. You tell me, are they doing enough? And that's starting in January. So we need the more testing sites now. We need people to have reason to get the tests now also. And we need sooner than 115. Why 115? January 15th. Why are you waiting that long for private insurance to cover the tests? Do you think that the holiday bump is going to be over by then? Like, what is the reason? I don't know. I'm just speculating here. I really don't know. Why would you wait that long? I mean, we know insurance doesn't start on 1/15. Insurance starts usually with the calendar year. So it would start 1/1. Well, why doesn't the reimbursement start then? Are you concerned about having too high of a spike? Are you waiting for it to just go away? I really don't know. It doesn't make any sense to me. But again, paltry, not enough. This is insufficient.
We'll be getting these tests to Americans for free. And we'll have websites where you can get them delivered to your home. We've arranged for it to be easier for you to find a free COVID testing site near you on Google. Just enter COVID test near me in the Google search bar, and you can find a number of different locations nearby where you can get tested. We're going to continue to use the Defense Production Act, as we did earlier this month, to make sure we're producing as many tests and as quickly as possible. The bottom line is it's a lot better than it was, but we're taking even more steps to make it easier to get tested and get tested for free. Next, we're preparing hospitals for what's coming. Those 40 unvaccinated adults have a good chance of getting COVID-19, and some of you will get very sick.
Did I doze off again? Which 40 adults? Did I miss something?
That'll mean hospitals are going to get extremely stressed again, both in terms of equipment as well as personnel to care for those who get sick. That's why my administration has stockpiled and pre-positioned millions of gowns, gloves, masks, and ventilators. We call it PPP. We're ready to send them immediately to any state that needs more. In addition, I've directed the Pentagon to mobilize an additional 1,000 troops to be deployed to help staff local hospitals and expand capacity.
And why is there that need? Is it just increased demand, or is it that healthcare workers in various positions have been leaving or going out on strike? Are these the U.S.'s plans for breaking future strikes and solving future, quote, labor shortages? Just conscription, basically. I mean, it's not exactly conscription, but I mean, using the people who are in the military for one reason or another to just start doing jobs that the rest of us are struggling against the capitalists over the conditions on. It's worth asking because we are in a situation of heightened class struggle. Conditions have gotten really bad. You know, for decades, a lot of people on the left have been asking rhetorically, you know, how bad does it have to get before people start fighting back? I think we're finally seeing that. And yeah, you know, they got all these people in the military. I mean, will you start seeing, military troops as checkers at Walmart, or, doing all these other jobs to break strikes? Who knows? Speculation, but continuing.
That's 1,000 military doctors, nurses, and medics. We've already started moving medical teams. They've already landed in Wisconsin and Indiana this week. This is on top of 300 federal medical personnel that are now on the ground, having deployed since we learned about Omicron. Look, while we know staffing is the biggest need for hospitals, some may need more beds as well. We're prepared. I've directed FEMA to activate the National Response Center and begin deploying teams now to provide additional hospital beds. We'll begin to construct emergency capacities near hospitals, in parking garages, and nearby buildings to be ready if needed. And the federal government is paying for all of this, period, all of it. Further, FEMA will deploy hundreds of ambulances and EMS crews so that if one hospital fills up, we can transport patients to beds elsewhere.
So, can I just say, first of all, if there's one thing that the anti-vax crowd loves, it's FEMA, paging Glenn Beck. But it seems to me like reassuring people, quote unquote, that they are having military personnel and FEMA set up all these emergency overflow units. That, to me, stands in contrast to the earlier messages about everything's fine and you don't have anything to worry about. Well, what exactly are you anticipating then? Why else would you be setting these up? Did you set them up during Delta? Then why do we need them now? So, yeah, I call bullshit on all that earlier. Just like I said, don't worry about Omicron. And I was like, yeah, I am worried about Omicron in a way I have never been worried during this entire pandemic. And I have been worried during this pandemic. This is, for me, a new level. And Biden's like, there's no problem. But also, we're going to be setting up giant overflow centers. Wait, what? So, yeah, I would read between the lines there and kind of expect really bad things in store. Continuing.
This week, we'll send dozens of ambulances to New York and Maine because the COVID is spreading very rapidly to help transport patients. Our doctors, nurses, hospital staffs have gone above and beyond during this pandemic. The strain and stress is real. I really mean it. It's real. And we'll have their backs, though. We have to let them know we have their backs. Finally, we're making sure that COVID-19 no longer closes businesses or schools. Last week, the federal court reinstated my administration's vaccination or test. The vaccination or test rule for businesses with more than 100 employees. The rule requires employers with 100 or more employees to protect their workers who are on site and indoors with the requirement that they be vaccinated or tested each week or go home.
Okay, so 2 points here. First of all the anti-vaxxers who are screaming about the mandate, you have an out. Just fucking get tested. Seriously. Like, if you're not going to protect yourself from severe illness, whatever. But you can get tested. Like, relax. Anyway. Second, that should be everyone gets tested, vaccinated or not. We need to actually track this thing. So, I don't know, just relying on the, unvaccinated to be the guinea pigs, like, that isn't a sound strategy, because basically you've set it up there that, like, the business almost wants some unvaccinated workers because then somebody's getting tested and you'll know if there's an outbreak. Okay, but if there's an outbreak, you shouldn't have vaccinated people working either. But, let's step back from all of this for a minute. We have basically a society at the brink, and I think that the next 6 months, maybe year, but I don't know. This feels decisive to me. It like I said, I am feeling more concerned about Omicron. This isn't an abstract thing. This is, to me, like the situation I've been concerned about, things blowing up into for quite a while. This could really be kind of make or break, I think, for the U.S. economy, and then the politics obviously follow that. Biden is already suffering from very low approval ratings, riding the left partly to get into office, making promises. But this isn't even about just the left. It's about really kind of mainstream people going, what the fuck is going on in this country? Biden sent out a tweet earlier this week or last week bragging about, hey, now there used to be 18 million people getting benefits. Now there's only 2 million. It's not that we don't need the benefits. You just fucking turned off the tap, buddy. We need those benefits, actually. Again, see the earlier thing about the child tax credit. People are spending this money that you give them on food, rent, clothing, and utilities. People are lacking for the basics. I mean, we just, apparently squeaked by this student debt thing being reinstated in a month. Like, it's ridiculous. It's absurd. Again, I'm really, really eager to hear the questions that people ask him. I saw the end of this. Basically, after one question, he just gives an answer and just walks out. This is not, even by bourgeois standards, the kind of leadership that this is really shit tier. I'm seeing George W. Bush, but fast forward to 25 years old when he's this old, frail, barely coherent person. How many times has Biden misspoken during this thing? The whole thing, it just seems very precarious to me. Continuing.
These rules are going to keep workers safe, and keep workers safe will help keep businesses open. If people are vaccinated or tested, they're much less likely to get sick and less likely to spread it to others. Okay, no. I think I'm finally starting to process this thing. I've heard enough of it now that the wheels have been turning, and this is a recipe for failure. This is suicidal policy. He's been going for however long he's been going for now. He has said basically just vaccine, vaccine, vaccine. We're not closing businesses. We're not closing schools. And, oh, by the way, we're adding, troops and FEMA to handle the overflow of the sick and dying. Yeah, this sounds like the U.S. capitalist class is just, what phase are we on? Quadrupling down?
I don't know where this ends. You know, I said before, this seems like it could be make or break. The next 6, 7, 9 months, I don't know. But I think that we're seeing an already weak U.S. making a gamble here that, stepping back again. Look at China. It's like they haven't had to do these kinds of severe lockdowns in a long time because they got it under control ages ago. The US does not need to be floundering like this, but it is because, we just had the Battle of Cheesecake Factory last week where like 30 people staged civil disobedience to go into Cheesecake Factory without showing their vaccination status. That's where we're at. That's where the mindset is. If, all of that old way of thinking needs to go down in a colossal, catastrophic failure, I mean, it has to go down at some point. Socialism truly is the way of the future as the world gets more and more interconnected. And just this highly individualistic mindset cannot remain. It's a product of a certain age, and that age is already, well on the way out. This way of acting, this extreme individualism, it just can't last. And people trying to die on that hill, you may literally die on that hill of COVID. I mean, it's just, why not give yourself an easier time? Try adapting for the future that inevitably is coming in. It's either that or complete collapse. I mean, that's not really in anyone's interest, but this is where we're at. This whole, we're not having any more closings of businesses, schools, whatever. It doesn't add up. It doesn't line up with the other things that Biden is saying here. And I'm getting more and more alarmed listening to this.
Customers are more likely to come in and shop because they know it's a safe environment. I know vaccination requirements are unpopular for many, and not even popular for those who are anxious to get them. My administration has put them in place not to control your life, but to save your life and the lives of others. Where 400,000 Americans died from COVID this calendar year, and almost all were unvaccinated. Almost all were preventable. The rule is legal and effective. It's going to save thousands of American lives. We must also keep our K-12 schools open. Look, the science is clear and overwhelming. We know how to keep our kids safe from COVID-19 in school.
You know he's lying because he doesn't cite anything to back it up, and he switches to that creepy salesman voice. That, combined with the gesture he just pulled, major bullshit incoming.
K through 12 schools should be open, and that safety is increased if schools require all adults who work in the schools to get vaccinated and take the safety measure that the CDC has recommended, including masking. I got Congress to pass billions of dollars in school improvements, ventilation, and social distancing. Schools should be safer than ever from COVID-19.
But are they safe enough? Can you guarantee that? And what if they aren't? Let me guess. Vaccine. It's just not cutting it. There's no plan B here. There's like no other measures that he's really talking about. The reason why this is adding up to more of an alarmed feeling for me is it's clear that this is their last move, their last chance. This is why I was saying I think that the next, year and probably shorter than a year is going to be pretty decisive. Because if they're making a, stake like this, I don't think it's totally by choice. I mean, you look over the last 2 years, things have not been good. And now they're just like full speed ahead. I think that that's coming from desperation, my opinion.
And just Friday, the CDC issued a test to stay guidelines. So schools can stay open and kids can stay in class even if a classmate tests positive. COVID-19 is scary, but the science is clear. Children are safe are as safe in schools as they are any place, assuming the appropriate precautions have been taken and they've already been funded.
So I would certainly like to see something, anything to back that up, because this sounds like total bullshit to me. You just said that you know that you have a COVID-19 outbreak in a school and that the kid is as safe in that school as anywhere else. No, they're going to bring COVID home to their parents and spread it around. You're just, how is that safe? Like, how? How is that safe? Explain that. He's not explaining. He's just the science. What science? What the fuck are you talking about?
Let me close with this. I know you're tired. I really mean this, and I know you're frustrated. We all want this to be over, but we're still in it. And this is a critical moment. We also have more tools than we ever had before. We're ready. We'll get through this. As we head into the holidays, I want us to all keep the faith. I want to sincerely thank you for your perseverance, your courage, your countless acts of kindness, love, and sacrifice.
So this honestly basically sounds identical to any given pep talk that the CEO of a company might drop in once a year and make. It's empty words. I mean, it should be taken with, about as much seriousness as any, CEO popping in once a year. Just be like, I know you're tired and you're working hard, but we'll get through this and our company will continue to succeed. That's basically all he's doing here.
During these last 2 years, throughout our history, we've been tested as a people and as a nation through war and turmoil. We had to ask whether we'd be safe, whether we'd be okay, whether we'd get back to who we are. We've always endured because remember, there is no challenge too big for America. I mean this from the bottom of my heart, no challenge. We've come through better and stronger because we stay together as the United States of America. That's what we have to keep doing today. We can do this together. I guarantee you. May God bless you all, and may God protect our troops. And happy holidays. God love you all. Thank you.
So that was awful. The ending, the whole thing. I mean, the ending. He, may God protect our troops. What was that? He had the nerve also to throw in like, we've been tested as a people through war. I mean, most of the wars you've started, or they've just been wars with other imperialists to take over a bigger share of control over dependent and exploited countries. I mean, really, that was in horrible taste. And then, the whole stumbling over the end was just a nice touch with like, may God protect our troops. And, oh yeah, by the way, Merry Christmas. Like, great. Let's hope that people ask him some pointed questions.
Mr. President, Mr. President,
On testing, sir, you said we have to do better, but public health officials have been saying for months you need to surge rapid tests for just this moment. Is it a failure that you don't have an adequate amount of tests for everyone to be able to get one if they need one right now?
No, it's not, because COVID is spreading so rapidly. If you notice, it just happened almost overnight, just in the last month. And
so what? Mr. President.
That was it? Just in the last month? No. That that was not an answer. Look back at the daily case chart. It's very easy to read. Also, look back at last year. This is highly predictable, this entire scenario that we're in. I mean, barring Omicron, although you have to be prepared at any given moment for a new variant to arise that could be more contagious. You have to know that. I mean, in the last video, I put a thing from Kopmala saying, oh, we, got blindsided by Omicron. Anybody who knows anything about COVID, I mean, we've already seen Delta. We've seen Mu, which didn't turn into a big thing. But I mean, Delta did. It became the worldwide dominant strain. You have to be on guard for that at all times. Biden's like, oh, how could we know? It's like, how could we know they would fly planes into the buildings? Well, I don't know. You had intelligence briefings about it, let alone, I mean, that's a whole story in itself. But I mean, this kind of playing dumb, it doesn't work. Anyway, that was his answer. I feel worse now than before. What's the next question?
And so, no, it's not a failure. But the alarm bell went off. I don't think anybody anticipated that this was going to be as rapidly spreading as it did. And so the question is, we had a lot of people who have access to the tests, who could order them, could have their insurance pay for them, et cetera. But it also, and all of a sudden, it was like everybody rushed to the counter. It was a big, big rush. And I knew that was coming. So what I tried to do is meet with the companies and use the Defense Production Act to get 500 million more tests and figure out how to get them to their homes, get them on the shelves in the store. I mean, so that's what it's all about. Yes.
Mr. President, what's your message to Americans who are trying to get tested now and who are not able to get tested and who are wondering what took so long to ramp up testing?
Come on, what took so long?
Yeah, come on isn't a fucking answer, you fucking dimwit. So that's what you're running with. Your answer is, come on, what took so long? That's what Biden has to say, which is basically just saying, fuck you for asking. That's his response. Biden says, fuck you for asking. You know, this is a guy from a party that's all about accountability and transparency, and then people have questions, and the answer is just, come on, what are you asking me that for? You're the person in charge, aren't you? Anyway, I mean, at least playing by the rules of this, you know, political dog and pony show that they've set up. You've signed up for the job with the guy who pretends to be in charge. Let's, you know, when we're getting basically fuck you for asking.
I'm hearing that from people who are trying to get tested now before the holidays.
Well, what took so long is it didn't take long at all. What happened was the Omicron virus spread even more rapidly than anybody thought. If I had told you 4 weeks ago that this would spread by a day-to-day basis, it would spread by 50, 100%, 200%, 500%. I think you would have looked at me and said, Biden, what are you drinking?
Actually, no, we wouldn't. This is a pathetic sham that he's putting on. We've already seen that with Delta. Everybody is already on the alert for this. I mean, we've already seen this. This is not the first major variant to arise that is more serious than the last one. Everybody was in fact prepared for this who is in any kind of a position of seriously studying or trying to deal with the pandemic. And yeah, unfortunately, that does not include Joe Biden. So let me tell you, I think, what actually happened in my opinion. Biden decided to declare mission accomplished back in May. Everybody can take the masks off. And we stopped distancing. And basically it was, you know, oh, there's never going to be a shutdown again. Go enjoy the summer. And I think that Biden and his team just basically, and, you know, obviously the interests that they represent, decided that, you know, they're going to cross their fingers and just hope that no major new variants arose and that they could at least maintain it at that level. Again, I'm not going to put it up on the screen again, but looking back at the daily case count, things were not good this summer into the fall either. So, I mean, even coasting on that was terrible. But, you know, they were really not wanting, you know, Delta plus, like some new Delta to come into play. But that's exactly what happened. But now he's treating us like the assholes for saying, why didn't you see this coming? And he's like, come on, nobody could have seen that coming. Yeah, actually, everybody's been sort of like, you know, this has been a real possibility at any time. Again, I think that Biden was just crossing his fingers and just wishing for this whole thing to go away. And it didn't go his way. And now he's just trying to find somebody else to blame. He does not want to own up to it.
But that's what it did. Now, we don't know what's going to happen from here. It looks there's some evidence that in South Africa, where a lot of this started, that it's dropping off quickly, too. We don't know. But I do know that we're not going to be in a position, like I said, when we were having a problem with masks and gowns and the like. I said, I promise you. Remember the criticism? I got questions from some of you. Why are you still paying for all these masks and gowns? Why are you stockpiling this? Because we don't know. Turns out we're going to need them. In the back, and then...
Does it work, sir? And will you reverse the travel ban now that Omicron is so prevalent here in the U.S.?
I'm considering reversing. I'm going to talk with my team in the next couple of days. Look, remember why I said we put the travel ban on, is to see how much time we had before it hit here so we could begin to decide what we needed by looking at what's happening in other countries. But we're past that now. And so it's something that is being raised with me by the docs, and I'll have an answer for that soon.
Mr. President,
You talk often about the importance of keeping your word of trust. Do you believe Senator Manchin kept his word to you? And how do you rebuild trust with progressives in your party to advance your legislation now?
You know, I told you before, you've heard me say this before, some people think maybe I'm not Irish because I don't hold a grudge. Look, I want to get things done. I still think there's a possibility of getting Build Back Better done. And what I don't want to do is get into, and Joe went on TV today, and I don't know whether it's TV or not, I'm told he was speaking to the Liberal caucus in the House and said, Joe Biden didn't mislead you, I misled you. And so look, I'm not looking for, let me say something.
So before Biden says whatever it is that he's going to say on this whole subject of, hey, you just let 2 senators destroy, what could be like landmark signature legislation. Biden's position here is, hey, there's still a chance it could get done and no hard feelings with Joe and we're going to get something done. And so actually for people out in the United States, we need help, like a lot. Things are not good. There are multiple crises in the United States: housing crisis, job crisis, student debt, medical, on and on and on. The Democrats have not delivered. They haven't even come close. I mean, this is not super surprising, but they could at least pretend to be a little bit more concerned. Biden's just like, I don't know. I'll talk to him when I play tennis with him this afternoon, and we'll see. I mean, hey, maybe the country gets fixed and maybe it doesn't. Whatever. Next.
You saw what happened yesterday. All the talk about how my Build Back Better plan was going to increase inflation, going to cause these debts and all the like. What happened? Goldman Sachs and others said, if we don't pass Build Back Better, we're in trouble because it's going to grow the economy. And without it, we're not going to grow. And what happened? Stock prices went way down. It took a real dip. If you take a look, everybody thinks because I quoted 17 Nobel laureates saying this is going to help inflation. Think about it in terms of you're a hardworking person and you're making 60 grand if you're alone, or if your mom are just on her own, or if you're making 80 grand, mom and dad 90 grand like a lot of people do.
Yeah, for a, quote, hardworking person, that's kind of a lot of money right now. I mean, just the way that the labor market is. And many people actually make nowhere near that amount, nor do many people expect ever to make that much in a year in their lives. So these are the priorities. I mean, this is, who Joe Biden thinks the, quote, little people are, apparently. And just on the earlier thing about, we need the help and everything else, mostly, I mean, I'm criticizing Joe Biden even in the terms of the current bourgeois framing. I mean, obviously, we need to move beyond capitalism entirely and do this. But even within the framework that the Democrats have themselves set out and are playing within, they're not doing as much as they could be, let's put it that way. It's a failure even in their own terms. Of course, they don't care because they're paid to serve the 1%. That's their thing and whatever. So, they are staging this fight with the, more reactionary Republicans, and they're holding up the plans of Goldman Sachs and whatever. And it's just like, look, for us working people, either of these factions winning is not good, does not get us really closer to socialism. But as far as trying to survive in the meantime, I think a lot of people voted for Joe Biden hoping that there would be some extra crumb that, might help them not starve. And I don't know that we've even seen that.
And you're worried about inflation, you should be worried about it because it's a devastating thing for people who are working class and middle class folks. It really hurts. Where is most of the cost now? The cost is finding in gasoline, even though I put even though I was able to bring it down 12 cents a gallon, will come down more, I believe. We talked about what the cost in food prices going up, et cetera. But look what's in Build Back Better. Childcare. You can reduce it by up to 70%. That'll be the difference between 20 million women who aren't back in the workforce being able to go back if you pass it. We're talking about healthcare, insulin. In a situation, we got 200,000 kids with type 1 diabetes. You know what it's costing? It cost somewhere between 10 cents and $10 to come up with the formula, okay, a while ago, right? You know what it's costing on average? $560, $640 a month.
Yeah, and what are you doing about it? I mean, sitting here and sort of idly fantasizing about it, the question was, did Joe Manchin betray you? And sort of, what are you doing about it? Biden's just kind of, this sounds like some conversation he had with Bernie Sanders at some point, that he's just sort of, for some reason or another, deciding to step through out loud into a microphone. I don't know.
So $1,000 a month. What do you do if you're a mom and a dad working with minimum wage, busting your neck? You look at your kid, and if you don't get that vaccine for him, if you don't get that drug for him, if you don't get be able to take that, what happens? They're likely to go in a coma, maybe die. Not only do you put the kid's life at stake, you strip away all the dignity of a parent.
So I'm sorry, I find it so just off-putting and disturbing when Biden does that weird, sudden change in volume and tone of voice. It's a lot about Biden is creepy. That just comes, he seems unbalanced when he does stuff like that. It seems like this just sort of sudden, unpredictable violence. And he's done it before in speeches to try to make a point. To me, it comes off as creepy and abusive. And I just had to say that because that bothers me every single time he does that. 1 minute, he's sort of whispering in your ear and putting you to sleep. And the next, he's getting really alarmingly stern. That's fucking weird. And really, just I can't believe this guy is president.
Looking at their child. I'm not joking about this. Imagine being a parent, looking at a child, and you can't afford. You have no house to borrow against. You have no savings. It's wrong. But all the things in that bill are going to reduce prices and cost for middle class and working class people. It's going to reduce their costs. What's inflation? Having to pay more than the money you have because things have gone up. Well, bring down all those costs across the board, from child care to a child care tax credit. But I'm not supposed to be having this press conference right now.
Would you support standalone? Mr. President, did Senator Manchin break his commitment to you? When you announced the framework, the White House says that all 50 senators were believed to get behind it, all 50 Democratic senators. So did Senator Manchin break his commitment to you?
Senator Manchin and I are going to get something done. Thank you.
And that's the end. That was it. He walked out after that. He said thank you, and he just walked out to the left. And people had obviously many more questions to ask. What he did was he just filibustered. He just told that as was the style at the time, he just went on this long thing about how he used to tie an onion in his belt and then didn't take any more questions. That's what we got. I'm not supposed to be having this press conference. What the fuck are you talking about? So a reporter tries to get it back on track. Did Manchin break his commitment to you because they said X, Y, Z? And he's just like, we're going to get something done. It's nap time now. And that's it. I didn't really get answers out of this. This was bluster. If anyone out there came away from watching that Joe Biden press conference feeling better about the situation, let me know in the comments, seriously. Anyway, I am pretty wrecked. This was a very long commentary, so I'm going to end it here. If anybody has any comments, leave them in the comment section below. We always have some interesting discussion down there. We'll keep it going. I I don't know what else to say. I mean, I'm outraged. I'm infuriated. This is a situation where clearly the people who run the United States just want absolutely no responsibility for what is taking place or the horrors that are likely to unfold in the coming weeks from Omicron. And I don't say that lightly. I think that this may wind up being the worst phase of the pandemic. And keeping in mind, Biden's whole thing again with the vaccines, yeah, that's great if you're in the United States and you can get vaccines. And then the rest of the world, it's going to keep circulating around the world and around the world and around, and it comes back again to Fortress America, to Fortress Europe. It comes back again. So how many years is this going to go on? They're very clearly now laying down this policy of just everybody get vaccinated. You will be blamed for everything if you don't. And really, do get vaccinated, people, seriously. But basically shirking any other responsibility except for these odd sort of token gestures that he mentioned, did not really lay anything out for people to follow or to study or understand about what exactly they're doing. And then, if we don't know specifics, we can't question specifics, and we can't say, well, that's likely to work or that isn't likely to work. Anyway, I think we'll probably come back to this topic again and again. So that's it for now. Thanks for listening. Again, leave a comment. Thanks to the current patrons whose names are on the screen. If you'd like to get your name on the screen, patreon.com/socialism for all. You can sign up for as little as $2 a month. Everything is appreciated. I'm not independently wealthy, so every contribution is both encouraging and materially helpful. I actually use those dollars, so I appreciate it a lot. Otherwise, if you want to help the channel without making a donation, liking, subscribing, notifications bell, leaving a comment, even if it's just thanks or good video, all that helps to boost the video and the channel in the algorithm, as well as sharing it on your social media, wherever you're on social media. And you can come follow at twitter.com/socialism S4A. That's probably where I'm most active right now. Otherwise, join an organization if there's a good one in your area, or at least make a contribution. We do need to get organized as time goes on, or start a project of your own if you've got the idea, enough experience, and the comrades and resources to get it off the ground. A lot of people are doing some really interesting things, and I think we just need more and more of that. All right. Thanks again, and we'll catch you in the next video.